Hello, sisters. Welcome to the Sacred Medicine Podcast, weaving powerful, soulful practices into functional medicine. Step into this beautiful space of devotion and explore everything from nurturing foods, rituals, sexuality, and awakening your innate sensuality. It is time to own your radiance. This is the Sacred Medicine Podcast. Hello and welcome back to another week of the Sacred Medicine Podcast. I am your host, Margaret Romero, and this week we have a return guest, Dr. Carrie Jones. Dr. Carrie Jones is a naturopath and the medical director for Precision Analytical. And we are talking all about hair loss in women. This is such a growing topic. It's so common. I have women, patients, I've got girlfriends who are asking me about this all the time. And if you've noticed any thinning around the crown of your head or even around the temple area, this interview is for you. So we are talking all about some of the reasons why you may be experiencing some hair loss. And then also what lab work you should be getting and what lab work your doctor should be doing for you in order to really figure out like what is going on. And the hormones are a huge, huge topic. So we talk all about the hormones. And then we also talk about what are some of the things that could be causing it. We talk a lot about vitamin deficiencies. That plays a huge role in hair loss in women. So we talk about that and some of the things that you can be taking and trying, some over-the-counter stuff. We also talk about the downsides of things like Rogaine and propecia. So it seems to be a common thing that most docs will just casually say, just try the Rogaine. It does have its side effects, and there are other ways to find the root cause of why this is actually happening and why you're experiencing some hair loss. Let's see what else. That is pretty much it. We talk so much about also medication, prescription medications that we can also use and consider if you have high testosterone, high DHE levels, DHEA levels, if those are high, and how to bring those down quickly and safely. And the reason why you may be having elevated levels in testosterone. So lots of good stuff here. Hope you enjoy it. I love Dr. Carrie Jones. She is awesome. So on to the show. This week's guest is Dr. Carrie Jones. Thank you for being back on the show again this week. How are you?
I'm great. How are you doing? Thanks for having me back.
Yeah.
The first time, we're going to do it again.
Totally. And this week we're talking about hair loss in women. And this has just been so common. Just recently, more of my girlfriends have called me and talked to me about this. I also have patients who have noticed some thinning in their temple areas. And so I thought I would have you back on so we can just talk about this, talk about hormones and all that good stuff. So let's dive right in. So what would you say are some of the common reasons for hair loss in women?
Most definitely hormonal. There's like, I count on my fingers, like the big ones. So for sure hormonal. And by hormonal, I mean, like estrogen can affect it. Testosterone can affect it. The pathways it's going down can for sure affect it. Thyroid, hyper or hypothyroid, either way will cause hair loss. Anemia, especially iron deficient anemia, can cause hair loss, or not even full blown anemia, just being lowish on the low end in iron. I'm sure you'll see this. People will say, yeah, my doctor told me I'm a little low in iron, but I'm not anemic, so I don't have to do anything. But meanwhile, they have all the symptoms. Well, maybe we should do something. Stress. People don't realize that stress, is a huge one. I after a major significant stress in people's life, I'll ask them, I'll say, did you get the hair blowout yet? And they're like, yeah. How did you know? I'm like, yeah, it's what happens. It seems to be like this shedding thing, like your hair will hold on And then as the stress starts to decline for whatever reason the stress is, they're like, all of a sudden my hair is coming out constantly. I'm like, it's cycling. It's like the blowout cycle. It's kind of like a postpartum, like after delivery, women will keep all their hair in pregnancy and it's all big and lush and full. And then they deliver and they're like, what's happening to my hair? I'm like, it's the blowout.
Yeah. Losing
it. So those are definitely, and then the other people, you can honestly have little, infections in your scalp. You can have irritation and, little, bacteria or something that's going on in your scalp that's causing the hair follicle to let go of your hair. And now you've got some sort of hair loss. I don't find that to be nearly as common as the other reasons, but I have had some women who have gone in and, gotten some sort of scraping or even had a little scalp biopsy and turned out they had an infection in their scalp and had to deal with it.
Now you're talking about like the tinea, fungal?
Fungal. Mm-hmm.
Yeah.
Mm-hmm.
They usually will see that with patches, right? I've seen so many women with like completely bald patches and sometimes multiple or sometimes just one. But I also see the temporal. So let's talk about when women start to have it decrease like around the temple area. That seems to be pretty common.
It's super common. And I do hear that a lot and see that a lot, especially with hormonal shifts. When I'll see that with testosterone, especially. So some women, you may have normal levels of testosterone or even, low levels of testosterone. But what's happening is it's going down a particular pathway. It's called the 5-alpha reductase pathway. And when it goes down that pathway, you're more prone to, we call male pattern baldness. And so you get that temporal loss of hair where you sort of get this, almost like receding hairline to a degree,
right.
Right at the temple area. That's not fun. And so I'll test them and I'll say, hey, your testosterone's normal, but what you do make, it's going down this pathway. And that's what's causing it. And there's a few things that will stimulate that pathway. I mean, unfortunately, some people just genetically choose that pathway. But again, very high stress can push that pathway. Inflammation. So I know that's a very broad word, but even things, like intestinal inflammation, muscle pain, joint pain, like anything, like if you're eating foods that you constantly shouldn't be and it's causing, inflammation in your body. That can do it. And then blood sugar dysregulation. People don't realize when their blood sugar's out of whack, when their insulin's out of whack, it will push that hair loss pathway. And when they address the inflammation and address their blood sugar, they notice their hair loss gets a lot better.
Great. And so, well, then are you seeing this then in diabetic women?
I can. Yeah. Yeah. And it's really common for diabetic women for a number of reasons to lose their hair. One, they will often choose this pathway, but two, that high blood sugar, it gums up the little tiny capillaries and now the hair follicles can't get nutrients and they lose their hair. Just like a lot of diabetic women will lose hair on their leg hair will stop growing because they don't have good circulation anymore and they can't get nutrients and oxygen and everything to the follicles. It's the same in the head.
I used to hear that massaging the scalp with, what was it? Like cayenne pepper, like to help stimulate. You think, is there truth to that?
I think there is cayenne. And the other one is peppermint or spearmint oil. So if you get peppermint or spearmint essential oil.
Yes.
Now you have to dilute it, right? Like put it in a carrier oil. And it's oily. it's a mess, but that can be really helpful. And spearmint, and peppermint, but spearmint in particular, has been researched to show that it helps sort of block or lessen that pathway that I was talking about, that 5-alpha pathway. And then it's just tingly. So it helps with circulation and it helps with blood flow, which is why a lot of shampoos you'll see they'll add peppermint or they'll add eucalyptus to it. It's tingly because it really helps circulation for your hair follicles.
I used to go to a place when I lived in Santa Fe to get my hair done, and they would use either peppermint, depending on, they were like, what do you need today? And they would have like lavender, and I know lavender doesn't have anything to do with it, but It used to be sometimes peppermint that they would massage into my scalp before washing my hair. And it was like the best thing ever.
Yeah. Yep. Absolutely. So there's definitely some truth to that.
Yeah. So that's a simple thing that women can do to kind of help stimulate hair. Even, I mean, you don't need to have hair loss in order to do it. You can just.
Right. Oh, yeah, absolutely. Absolutely. You can just use it or buy shampoos, that already have some peppermint or eucalyptus in there. Obviously buy healthy shampoos, right? The sulfate free and paraben free and, all that stuff. But there's a number of companies out there that are now adding it. Like that the Dr. Bonners, the Bonners. So he has a peppermint and I think he has a eucalyptus and oh my goodness, that'll wake you up in the morning.
Yeah, I bet.
It's like whole body tingly.
So when women experience hair loss, are they also on their head? Are they also experiencing it down in the pubic area?
It depends on the woman and it depends on the reason. So I will hear that, yes, with things like thyroid, but I don't always hear that with other reasons like stress. So if somebody is hypothyroid, they do tend to report just slow hair growth all over. Pubic hair, arm hair, leg hair, maybe is slower to grow than they were used to. But the hair on the head definitely is what everybody notices the most. Most women don't care if their pubic hair is thinner, right? Or falling out. Most women are like, whatever. Or arm hair. Like they may not even notice if they don't even have a lot of arm hair that it's a lot thinner. But when it's on your head and it's visible every day, that's where they pay the most attention. Whereas stress, I have found stress definitely tends to be more focused on the hair follicles on the head than the leg or the arm or the pubic area.
Got it.
Yeah.
All right. So what are some of the things that, let's say they go and they want to get tested and they go to their doctor, like can they go to their regular doctor and get it tested?
For some, yeah, absolutely. You can, for some of the testing, they have blood testing. You can absolutely get a full thyroid panel. Now, when obviously you know what I'm talking about, but when I say a full thyroid panel, most practitioners will just run one of the thyroid markers called a TSH, which is thyroid stimulating hormone.
Right.
And they think that's good enough. And I'm like, well, actually, no, there's a whole lot of thyroid markers. There's a T3, there's a T4, there are what are called thyroid antibodies, which test you for the autoimmune version of a thyroid problem. And you have to really look at all of them because they each play their own part in how the thyroid is doing in your body. Because TSH believe it or not, it looks at thyroid in your pituitary in your brain, but it doesn't give much information about how the thyroid hormone is functioning out in your body, like in your hair follicles on your head, believe it or not. So I say you have to do a really big thyroid panel, not just a single test. But then you can also check iron. You can check your iron levels and you can get something called a CBC, which are your complete blood count, your red and white blood cells, and then add in iron marker. You can add in iron storage, which is called ferritin. So you can even get a little pretty in depth with your iron as well with your regular doctor.
Yeah, totally.
Yeah.
Yeah. And then all the hormones, including testosterone as well.
You can. Now it's a little tougher, not because blood work is harder to show pathways. You can run obviously total and free testosterone. You can run estrogen, progesterone. You can run the other androgen hormone called DHEA. You can do that in the blood. But when it comes to pathways, then you're looking more at urine testing because blood's what's in circulation, but it doesn't tell you like which pathway it's going.
True.
You need to get the after effect. So in that case, then I do tend to recommend urine testing to see which way testosterone is going, or even which way estrogen is going through detoxification. And you can do cortisol when we talk about stress. You can do cortisol in the blood, but it's a one-time. It's just a blood draw. It's one time at whatever time of the day you happen to go in to see your doctor. And when we're talking about stress, it's definitely a much bigger test. You'll test several times through the day. So in that case, again, I'm either a lot of people will do, urine testing, dried urine testing, or saliva testing. Other people will do, we've heard of saliva testing for the adrenals. And the reason that is that you can collect multiple samples in the day and then see how your adrenal glands are actually doing.
Yeah. Yeah, I like that test. The cortisol, doing it by blood, depends on, I guess, if they had to do it with blood, I prefer a morning one as early as possible before you drink any coffee or anything like that, before any stimulants in the morning.
That's what I tell them too, to try to go right when the lab opens, just get up and go get your blood drawn.
Yeah.
Yeah.
And that it kind of gives you a little bit of an idea of kind of where they are. Is it a 4 or is it like a 24?
Right.
Yeah.
And either way, it's not good. A 4
right.
and 24
yeah,
are not
exactly.
that great.
So great. So this is, and then they can do the urine testing. And I mean, I know that you work for Dutch, and we can definitely talk about that, and I can add a link to that. But that's definitely one of the tests that I run as well. I do blood sometimes. And there's also the Dutch test. So that's a good test, and tell them a little bit about how that's done.
Yeah, actually, thankfully, it's not a blood draw. So for those people who don't like to get their blood draw, it's little pieces of filter paper that people will urinate on 4 times in the day. So they'll pick a piece of paper and do it first thing in the morning, 2 hours later, around dinner, and before bed. And they let the paper dry and then bundle it up, mail it in back to the lab. So they do it at home, and it's pretty easy versus having to go get your blood drawn.
Yeah. And then what's the turnaround time on that?
Once the lab gets it, it takes about 5 to 10 business days for turnaround.
Okay. Not bad.
Yeah.
Okay. So what are some of the things? Let's say a woman is, maybe she's gotten some blood work done, and the doctor's like, because I've seen this before with my friends who live in different places who have gotten routine things, and they like, I don't know, the doctor said that everything looks fine. Everything's normal.
Right. We hear that all the time, but yet they have all sorts of symptoms. And in this case, like hair loss. And so that's the difference between falling into the normal range versus an optimal range. So for example, if the range is 0 to 100 and you're at 1, your doctor may still say, well, you're in range, but yet,
right.
Like you're 1 point away. Or maybe you're at 99 and your doctor's like, oh, you're totally in range. I'm like, really? But 2 more points and it's a problem. And so then we were looking for more of those optimal ranges. And so sometimes I tell people like, hey, it's great that you went to your doctor and you got this drawn, but maybe you want to we call it a functional approach. Maybe you want to see a doctor who does, or even a practitioner, it doesn't have to be a doctor, nurse practitioner, or somebody who will look at it from what's going on with you. So tighten up those ranges, make sure you're falling into a range that will help you not have symptoms. So iron is a really good example. A lot of people will be they're in the range for iron, but they're kind of on the low end of range, and they have all the symptoms, right? They're tired, they have cold hands and feet, they're losing their hair, and they're being told that they're normal, they're in range. I'm like, well, you're in range, but you probably should be up an extra, 10 or 15 points. So
where do you like
something about it?
Yeah. Where do you like iron levels to be? Total iron.
Now I have to remember where I like my total iron. Where do you like iron levels to be?
Is it like 70? Why am I thinking 70?
Ferritin I like a lot higher, absolutely. So for iron storage, I want it above
around 70?
Yeah.
70 or more.
Mm-hmm.
Okay. Yeah.
I used to say 50 or more, but now I'm starting to think I want it higher.
Yeah, and I would say that what I also have seen is something like 25, and then it's still within normal, but that's really low.
Right.
Yeah.
Yes, exactly.
And so the doctor will be like, oh, no, you're fine. And then the TSH of like 4.2, and they're like, oh, no, it's within range. So that's fine too. But that
and
actually
I like the
is
TSH
too high.
under around 2. I mean, even
yes.
there's conflicting, right? Some functional practitioners say, oh, 2.5 is fine. Like, all right, whatever, 2 to 2.5, somewhere in there. But definitely once it's above 2.5, 3, 4, I'm like,
No,
come
it's too
on.
high.
And
Yeah.
it's annoying because depending on the lab, sometimes the lab will cut it off at 4. Other labs will cut it off at 5.2. And so it also depends on the kind of lab you go to,
Right.
that your range may be different. But either way, yeah, I agree with you. I look at TSH to be around 2.
Yes, definitely. If you're already at 3, I think it's too high. I
I
think you're
agree.
already,
Yep.
yeah.
Especially if they're symptomatic, right? Especially if they're displaying thyroid symptoms. Like, why wait till it gets worse to suddenly address it? Why wait for the symptoms to decline even more?
Yes.
And iron has a huge impact on thyroid, as you know, right? So
Right.
if you're losing your iron, or you're not absorbing your iron, or you're not eating iron, maybe you don't eat, you choose not to eat iron foods, foods high in iron, then you're going to eventually directly impact your thyroid. And now you're going to have this double whammy against you. You don't have iron and you're affecting the ability of your thyroid to function.
So what if someone has a chronic iron deficiency, then will they always have a chronic thyroid issue?
Probably yes.
Yeah.
Yep, probably yes. They'll have a lot of chronic issues because, iron is so important for so many things in the body, right? It's important for electron transport. It's important for getting your little oxygen to circulate around. I mean, it's just important for energy. I mean, it's important for everything. And so if you don't have enough iron, then you're going to be missing out on all of those things, and you don't feel good.
Right. And so many women have like heavy periods, and they
Mm-hmm.
can very easily become iron deficient.
And you need iron to help reduce a heavy period. So you get caught in this catch-22. You bleed out all your iron, but you don't have the iron to stop it,
Right.
to slow down the bleeding in the capillaries. And so you've got to get some extra iron in there to try to slow the period so that you can then retain your iron and not get caught in that vicious cycle.
Right. Right. Okay, so they come back. They're like, you know what? My doctor says everything's fine, and so they want to start me on Rogaine. The shampoo or however it comes. I don't ever. That's not part of my repertoire for suggestions when women come to me for hair thinning is Rogaine or propecia. So, what are your thoughts around that?
Ah, man, I agree with you completely. I have a tough time with either Rogaine or Propecia. They just have so many nasty side effects, and the effect on your liver. Propecia, the other word for Propecia is finasteride, and a lot of men will do that, and there's now a black box warning on it. It's called post-finasteride syndrome, in which suicide is one of the big known side effects. Like, oh, I don't know if improving your hair thinning is worth suicidal
All
ideation.
right.
And it's real. It's not like, like, oh, 1 in a million people might get it. Like, it happens. That's the whole reason they had to black box warning it. And it's the whole reason it's now a real thing, post-finasteride syndrome, if you look it up, because it was happening often enough that they had to take action. And so I don't know. I
Wow.
don't, and same with Rogaine. I know you can buy it, over the counter, and I know you just rub it on your hair, but it's not local. It doesn't just stay on your scalp. It doesn't just affect your hair follicles. Like, you absorb that in like anything else, like the
Yeah.
lotion you put on your body or on your skin. Like, you absorb all of that, and it can be pretty toxic.
Very toxic. I'm just looking up here some of the side effects. Irregular heartbeat, fainting, weight gain. Oh, I haven't seen weight gain with that. That's interesting.
I haven't either. I have had some patients who did Rogaine on their own, and they have had the irregular heartbeat. I have seen that. I have seen I haven't seen fainting. I have seen the chest pain.
Oh, yes. It says chest pain, difficulty breathing.
Mhm.
But it doesn't. Let me just put in toxins. What is it? Do you know exactly what it is?
Minoxidil.
And is it to, okay, that's what it does.
Because I thought it was circulation. It affected circulation. So when you put it on, kind of like we were saying, if you use peppermint or, spearmint or eucalyptus, that minoxidil opens blood vessels and improves circulation.
Yes, it's an antihypertensive vasodilator.
Oh, there you go. Yep.
I think I would just choose peppermint oil over that.
I agree. And, looking pretty seriously at some blood work, looking pretty seriously at thyroid and iron and stress and what have you. Because the great thing is, iron, if iron is a problem, you can eat foods high in iron, and you can take iron. Obviously, when it comes to iron, people get worried because they're like, oh, I've heard that causes constipation. There are better forms of iron, like iron citrate, doesn't always cause constipation. Iron is better absorbed with some vitamin C, some ascorbic acid, and that can help alleviate, any kind of constipation. I tell people to spread it out. If you have to do 2 or 3 or 4 capsules of iron, like maybe do 1 or 2 in the morning and 1 or 2 later in the day. Don't do just this huge big bolus of iron. But other nutrients go into the hair as well, like zinc. Zinc is really important for the thyroid. Zinc is really important for testosterone. Zinc is really important for lots of stuff. And we are somewhat of a zinc deficient nation because just our soil and just digestion and absorption, and we're just not getting it like we used to. And a lot of women have the copper IUD, and copper can counter zinc. And so now she's zinc deficient just because of her copper IUD.
Yes.
And so there's all sorts of other nutrients that come into play when it comes to hair loss. Selenium's super important for the thyroid and subsequently hair. Collagen, you see now there's collagen powders and things on the market.
So much.
But it's real. The collagen is really helpful for skin and for hair. And bone broth. Bone broth is the new hot thing, and it's for good reason. It's for bones, for skin, for hair, for all sorts of stuff. Like, we really do use that to build, to make hair and to have good skin. And so those things can be very helpful. Now, you have to be careful. Don't just buy off the internet and hope for the best. Like, buy it from a good quality company, buy a company that's actually organic. If you're doing bone broth, make sure that's, organic and grass fed and
totally.
And the big reason for that is what people don't realize is that when you in collagen or in bone broth, that when they use it to boil to make bone broth, farmers who spray with Roundup has glyphosate in it,
right?
And it stays in the marrow of bones, and so when you make bone broth and you're boiling the bones, you're just boiling out the Roundup that the farmers have used to spray.
Wow.
And then you eat it. And so that's why you have to be careful. That's what they've done some studies to find, like, oh,
wow,
gosh,
I didn't know that.
Yeah. You got to be careful with your bone broth source.
Yeah. I mean, I only get my bones from Whole Foods. They will sell just the bones, which is great. But if you don't have a Whole Foods, where do people then get?
You can ask the butcher. Like, there's a lot of people have meat markets around them. And just so you can talk to the butcher and ask, where do these bones come from? And are they conventional cows, just like any kind of bones? Or are they from farmers that the butcher is familiar with?
Right.
Are they grass-fed, cows? Or chicken. People will make chicken bone broth, right? Or turkey. They'll cook a turkey and then they'll take the bones and everything afterwards and boil it down. So if you know that the whole chicken you bought or the whole turkey that you bought is organic and, it says on it hormone free, then, much better.
Yeah. I love bone broth. Yeah.
Yeah. And you can buy pre-made bone broth, and there are a lot of good companies. You just read the label, make sure it says on there.
And what about
organic, grass-fed?
Yes. And what about collagen for you? Is there a particular brand that you like?
I go back and forth. Right now, I'm currently, because I bought them at a conference, I'm using the Dr. Josh Axe.
Oh, yeah.
AXE collagen.
How is that? How does that taste?
It's it's a little bone. It's a little collagen-y.
Oh,
It's yeah, to me. I know like a friend of mine like loves it. She thinks it tastes, amazing. It's a little collagen-y for me. But the one I used before was the Great Lakes. Um,
oh, yes.
the Great Lakes, and they come
Yeah.
in the red container or the green container on
Yeah.
Amazon.
Yeah.
And I didn't taste that one at all, and I love that one. I was just switching to the Dr. Axe products just to try it, and but they're good. They're potent stuff. I mean, I feel like I have great hair and great skin, so I must be doing something.
Yeah, when my
It,
dad was in the hospital last year and he had large bowel obstruction and he had emergency surgery and it was a very difficult recovery. I made him and he couldn't he had a colostomy issue
mhm.
happening. So they had him on clears and whatnot. So I went home and I made a huge batch of like Jello with the Great Lakes collagen in
Mhm.
there because I needed
Mhm.
his wound to heal. And so I would bring in a batch. I still do. I feed that to my parents.
Yeah.
I bought them the collagen and that's like one easy way that you can just like
It's
add it
super
in.
easy.
Yeah.
Yeah. The other big company just is Vital Proteins. That's the one. They're
Oh
in the blue
yes.
container. Yep. So I rotate. I use Great Lakes, then I've used Vital Proteins. I'm currently using Dr. Axe, and they're all great. It's but those are sources I trust, just like
Yeah.
you Great Lakes.
So, the other one I try that I actually really like that I don't feel is, you know, um, how you describe the other one is the bulletproof collagen. Have you tried theirs yet?
I haven't tried their collagen yet. No.
I mean, you can put it into your coffee and it dissolves and you don't even taste a thing. You taste nothing.
That's awesome.
Yeah. And so sometimes I'll do with
Nice.
with the butter and the brain octane and then I'll
Mhm.
add in a scoop of the collagen and
Mhm.
blend it up. It's not thick. It doesn't get nothing. It's really dissolves into virtually nothing, which is
That's
kind of
awesome.
nice. Yeah. So if you have a chance to try it out, I would.
I will. I will. I'll have them on my list next once I run out of the Dr. Axe products.
Have you tried the Vital Proteins creamer, coconut creamer
No,
yet?
I
Okay.
haven't.
That's on my list of something I need to try.
All these fun things.
There's always something new that I have to try.
Yeah, no kidding. Well, speaking of bad taste, have you ever done silica for hair growth?
No.
Not silicone, but silica. So silica is similar to collagen. It's really important for follicles and for hair growth. But the problem is, it comes in capsules or it can come in drops. I find that the drops seem to work the best as opposed to the capsules, but it tastes terrible, like horrible. It's like the most nastiest taste I've ever experienced.
Oh my God.
So when I tell people, with collagen, normally collagen, most of the companies, taste anything. So with silica, I always warn people, we're going to start silica for your hair, and we're going to do the drops because I think it's the most potent. But be aware, you need to put it in a little bit of water and slam it.
Oh
I
boy.
I think it's forcing your follicles to grow hair because it tastes so bad. But you can get silica in capsules. Definitely, you can do that. I just find there are certain drops and they seem to work really well. But you'll see silica mixed, of course, with collagen and zinc. You'll see these in like hair, skin, and nail blends, and so that's why it's in there because it is good for hair growth.
Okay, good to know.
Hmm.
And going back to the iron, do you prefer or is there a preference? Do you just have people go online and get it as a supplement or via prescription, like the ferrous sulfate?
Well, so that's tough. I find the ferrous sulfate is really hard for people to absorb, and it tends to rip apart their stomach.
Yeah.
And so, but it is, if they have insurance, then and it's because it's prescription, then it might be covered more than if they go and buy an iron online. But so I tell people, man, I'd rather you by a different form than ferrous sulfate, especially because we know those people who have digestive issues, right? IBS or candida or, food stuff or gas and bloating or anything, SIBO, small intestinal bacterial overgrowth, any little thing that's going to upset their stomach, like that ferrous sulfate's only going to make it worse. And so I'd rather go a different route for them because I don't want to make their stomach worse. And since that's where iron is absorbed, that can be a problem.
Yeah.
Have you done the iron patches at all? Have you looked at those?
No.
So my very best friend, who is also a doctor here in Portland, she started doing the iron patches that you can buy online. I have zero affiliation at all with the company, but she's using PatchMD, patchmd.com, and they have iron patches. And she said within a week, her hair was like 1,000,000 times better. She was losing hair. She found out she was anemic. And she started using the patches because she felt the iron was upsetting her stomach, no matter what form she took.
Interesting.
And she said it works amazingly well.
Oh, I have to check it out.
She said it's kind of a pain. I mean, it's a patch, and you have to change them every day or maybe twice a day. And it has, in her case, it had, the adhesive. She's like, I have little square adhesive marks all over my body that I have to always scrub off. But she's like, it worked. My hair doesn't fall out anymore. I was like, dang, in a week? That's fantastic.
That is. So, I have to check that out. Yeah.
Me too. Because I have a few other practitioners who've been using patch form of getting vitamins in, especially for people who have digestive issues and have a tough time absorbing. But she was my first, she's my best friend. And she's a doctor, so I trust her. I trust her review to be like, this is working. My hair isn't falling out.
Right.
For iron.
Very cool. Okay, so those are some of the supplements that are really important. And then, let's see here. And so what are some of the things? Are there any foods that you suggest? I mean, obviously, if someone's iron deficient, they're going to be having more iron-rich foods and things like that. But is there anything else?
I'm trying to think. I would definitely, I definitely think just eating healthy, right? If you're just eating healthy and you've got your blood sugar under control, because blood sugar, we know, gums up the works.
Right.
So if you have high blood sugar, not even if you're diabetic, but even if you just have that borderline high blood sugar, just be aware it's sticky. Sugar's sticky in your capillaries, and it will slow blood flow to your scalp, and now you can't grow hair very well. So if your diet is good and your blood sugar is under control, and you're eating iron-rich foods, and you're avoiding foods that bother you, because that will just increase inflammation. I mean, if you know that when you drink milk, it upsets your stomach, or it causes you to break out, or it makes you feel congested and snotty, don't do it, because it's doing that everywhere in your whole body, including, the follicles on your head for your hair. I mean, if when you eat bread, you react. If when you eat, whatever, corn, you react. Don't do it. You're just increasing the inflammation, and that will make your hair loss, amongst other symptoms, a whole lot worse.
Yes. And what happens? So let's say they go and they see the doctor, and the doctor's like, it's fine. Here, just do some Rogaine. And they're still seeing hair loss, obviously. And so then what? Who do they turn to? I mean, I guess
you. They call you.
That's true. And because I feel like some conventional docs may be not really looking at the whole picture necessarily, or knowing about supplementation.
Right.
And kind of just knowing an alternative, which is just propecia and Rogaine, and that's it.
Right. And in that case, then that's when I would say, hey, do some research and look into see a functional practitioner, an alternative practitioner who will look at the labs a little bit differently, or maybe realize you need more lab work, that just the screening, like a single screening iron and a single screening TSH for your thyroid is not enough. You need a lot more digging when it comes to hair loss. And then somebody who is then trained to know what nutrients can be helpful or even just digestion and absorption. Maybe it's all goes back to the fact that you eat enough iron foods, but you just can't absorb it, and bacteria use iron themselves to grow and reproduce. And so if you have an infection in your intestines, if you've got bad gut bacteria, if your microbiome is unhealthy, then when you take iron supplements, you're just going to feed those bad bacteria, and you're not going to get it. It's not going to get absorbed by you. And so sometimes, despite all, you do all this lab work and you find out, oh my gosh, I'm iron anemic, as an example. But you got to step back and go, oh, but I also have all these stomach problems and intestinal problems, and you got to get that worked up first.
Yeah. Yeah, totally. And so also with testosterone being high, let's say they check and their levels of testosterone DHEA are elevated.
Mm-hmm.
What are some of the ways to bring those levels down then?
Well, it depends why they're high in the first place. So first of all, it could be a condition, polycystic ovary syndrome, right? PCOS could be a reason. For other women, I always make sure if there's a man in your life who is on testosterone, make sure you're not getting contamination from him. So when men apply testosterone cream, they have to make sure that they rub it in really well and wash their hands really well. And then don't rub it into their skin and then touch stuff. Like don't touch with their hand, don't touch the counter, don't touch the faucet to wash their hand, because all that testosterone cream is now on the faucet handle. Be very careful when you're applying hormone creams, because the women will come right behind it, turn on the faucet, pick up the testosterone, and now her testosterone levels are high,
right? Which
can cause hair loss.
Yeah.
But if it's for other reasons, like that condition, PCOS, polycystic ovary syndrome. So then we work especially with insulin. So we're doing things to lower insulin. There's some good supplements for that. Like a popular one is inositol. But there are some herbs to help lower testosterone, one of which is white peony, like the flower. White peony can lower testosterone. Ground flax seeds, not flaxseed oil, but the actual ground flax seeds themselves will lower testosterone. But they will also lower estrogen, so you have to be careful there. So there's a lot of, it depends on why the testosterone's high that I'll.
Do you ever prescribe spironolactone?
I do. Mm-hmm. I do prescribe spironolactone. It's not my first choice, because I find spironolactone works very similarly on that pathway, that sort of 5-alpha reductase pathway. And I try to go the supplemental route first. So the supplements that help that pathway, if you're high, are zinc, which we talked about, stinging nettle root. So this time of year is allergy season, and a lot of people will see stinging nettles out and about. It's the root that actually can help reduce hair loss. Saw palmetto, which is really common in prostate formulas, but it works the same for hair loss in men and women. So saw palmetto is a good one. There's a little shrubby bush called Pygeum africanum. That's a good one for lowering that pathway. So lowering testosterone and then shifting the pathway are actually two different things. So that's why testing is important, because you might take all the white peony in the world and find no results, and that's not actually the problem. The problem is it's going down the wrong pathway.
Yeah.
But yeah, I have prescribed spironolactone, especially in extreme cases where I'm like, okay, we just need to slow this down while we're addressing the cause, and then we'll come back to the spironolactone and try to take them off of it.
Okay. Yeah.
That's what I will do. So I don't tend to do it. I don't do it often, for one, and then when I do it, I don't tend to do it long term. It's more of a whoa situation.
Okay.
How about you?
I'll occasionally do a spironolactone lower dose, depending also on how high their levels are. Mm-hmm. And I definitely the zinc, the saw palmetto, flaxseed, but I've never tried the stinging nettles for that, and the white peony. Those are new for me.
Yeah, they and make sure the stinging nettle is the root, not the leaf.
Oh, right.
Yep, root, not the leaf.
Is it the leaf the one for allergy season?
It is. Mm-hmm.
Oh, okay. Yeah, I've used it for that particularly. And then obviously decreasing insulin.
Yes. Yeah. Get their blood sugar and insulin under control.
I like alpha lipoic acid.
That's a good one. Yeah. ALA.
Yeah.
Yep. And it's protective for the capillaries. So if people have had maybe some damage to their teeny tiny blood vessels, that alpha lipoic, it's an antioxidant, so it can be helpful there too.
Great. This was really great. Was there anything that we missed?
Well, the one thing I want to just say to people is, if it's hereditary, there's a difference between hereditary and iron or thyroid or what have you. And so sometimes, unfortunately, despite all the workup, they're like, well, my mom, my grandma, my great grandma, like they all lose hair. So we're trying to do the best we can, but sometimes we just can't fight against hereditary. But also keep in mind that your mom, your grandma, your great grandma might have all had low level thyroid disease and nobody worked them up, right? Like that can get passed down generationally. And if nobody's really working them up, then you can be the different person. You can get worked up and realize like, oh, this has probably been going on through my whole family and we're going to do something about it.
Yeah. All right. That was awesome. So where can people find you? I know that you're at Dutch. I am at Dutch, which is dutchtest.com. If they want to learn more about doing that particular form of hormone testing and looking at different pathways and the adrenal testing. So yeah, dutchtest.com. And we have your webinar is on there, the one that we did prior. Oh, great.
So they can learn more.
And you're also on Instagram because I follow you.
I am on Instagram. Yep. dr.carriejones. And I'm all educational because I work for a company. I have nothing to sell. I mean, I have nothing I'm like no programs or anything. So all of my posts are just purely educational about hormones and about stress and about just lots of various stuff.
Yeah.
Detox and immune system.
Great.
Yeah.
Really great stuff there. Okay. Well, thank you so much for coming back on the show. Love having you on.
Yes. Thank you.
Have a good day.
Well, I super hope that you enjoy this conversation. And if you are experiencing some form of hair loss, now you know some of the labs that you will need to get done, some of the supplements, some of the nutritional deficiencies that may be causing a little bit of this hair loss that you're experiencing. So if you can't find someone, you may want to check out some naturopaths or functional medicine doctors in your area, or a lot of them do also virtually, and you can go ahead and finally figure out what is going on with your hair loss. To find out more about Carrie Jones and for all the show notes, head on over to margaretromero.com/episode 80. Can you believe we've reached 80 today? Maybe not so monumental, but it's nice to know that I have met at least 80 gorgeous individuals who have shared their wisdom. Some of them have been on at least more than once, especially Carrie. This is her second time she has interviewed with me. So, and we will add a link to the show notes if you want to hear what we spoke about the last time she was on. Hope you guys are having the most beautiful and fabulous week. Enjoy the weather. Here on the East Coast, it is starting to feel more and more like summer. So, big hug, lots of love sending to you all over the world. Talk to you next week. Bye for now.